I'm now pleased to introduce Los Angeles County Sheriff and ICAN co-chair, Alex Villanueva. Thank you.
Oh, thank you. I want to welcome everyone to the annual Interagency Council on Child Abuse and Neglect, ICAN, the press conference. Today, all of our major partner agencies that touch the lives of children and families in Los Angeles County come together to discuss issues related to child protection and vote on action items presented by the ICAN committees and teams. These agenda and action items will be shared with you today. You may link up to the meeting as well. In recent weeks, my department has investigated highly publicized cases involving very young victims, infants and toddlers. In one situation, Special Victims Bureau detectives investigated the abandonment of a newborn infant found in a trash can at a local park in Linwood. Fortunately, the infant survived, but this case highlights the critical importance of promoting the safe surrender baby law. Safely surrendering an unwanted infant at a hospital or fire station can mean the difference between committing a crime or providing for a safe and permanent home for a newborn child. The safe surrender baby law is included as an action item today. The other case had a more tragic outcome. Homicide Bureau investigated a case in East Los Angeles where 3 young children were killed while in the care of a parent. Cases like this are unbearably tragic and strike at the hearts and minds of my investigators and us all. We're committed to assuring justice is served for these children and hope ICAN's work can help prevent future tragedies such as these. There are several action items on the ICAN agenda today addressing prevention and response to severe and fatal child abuse. As the co-chair of ICAN, I'm committed to ICAN's mission of improving the lives of abused, neglected, and at-risk children.
Thank you, Sheriff. Good morning. Thank you for joining us. I want to remind everyone that ICAN's mission is really to protect children and bring agencies together and promote their health and safety and well-being. We promote training, community outreach, prevention campaigns, and interagency teams. But our work often takes us into dark corners of reality that compel us to call for action. Reviewing over 30 years of child abuse homicides has given us a unique perspective on how we failed more than 1,000 children. These victims were mostly infants and very young children. There was social isolation, families with histories of violence at home, critical information not shared between agencies, and parents who were abused themselves as children, perpetuating the cycle of violence on their own children. Most of the child homicide perpetrators have been males, so we'll look at how we can prepare men and boys for parenting. However, most of the child homicides this year have been committed by mothers. 2 mothers committed homicide on 6 of the 8 or 9 child homicides. This requires a focus on perinatal and postpartum issues. How do we connect with high-risk mothers and children at the earliest point in their lives, in pregnancy, and at birth, in hospitals, in their homes, and in their neighborhood? We become acutely aware of the real and often unimaginable heartbreak of children suffering from the loss of a parent or a brother or a sister. So we need to assure that every child who experiences the profound trauma of fatal family violence is provided grief counseling. And now we ask for action to address these and other issues today. Child abuse is not a law enforcement, it's not a mental health or a child welfare issue. It's a system-wide issue, a community-wide issue, a neighborhood issue, and a personal issue. Preventing harm to a child can be as simple as reaching out to a stressed neighbor who's struggling with 3 small children. We have seen how agencies in the community working together can make a difference. Declining child abuse fatalities, infants safely surrendered, in-home support, prevention, and lives changed and saved. So today we ask every agency and organization in Los Angeles County to join with us and to become a no-hit zone. So let me introduce Dr. Carol Berkowitz, who will present one of our featured action items today that we think will make a difference overall in the abuse and neglect and harm and fatalities of children. Dr. Berkowitz.
Thank you, Deanne. So our No Hit Zone is a campaign that we're launching countywide to promote positive parenting. It acknowledges the negative effect of physical punishment on children, the risk that physical punishment will escalate into physical abuse, that physical punishment has a deleterious effect on a child's well-being and on their self-esteem. And what we're starting out is launching the time that a child visits their pediatrician's office or a clinic as an opportunity to teach about positive parenting and to help substitute physical abuse. What the program involves is educating clinic nurses, clerical staff, and physicians to be able to intervene if they witness some activity, verbal or physical activity, while people are in the waiting room. Going to the physician, waiting long in a waiting room sometimes is really stressful for parents. And so we take this as an opportunity. I don't know if Marianne can show those 2 slides. If not, I may be able to, that show how our program is going out. There are booklets for families in both English and Spanish, as well as posters. Okay, so that's the poster that we have. It's being put up in all county facilities, and we hope at other agencies. We have it now at Harbor UCLA Medical Center, in addition to those booklets. So this is something we've been talking about for quite a while. In 2018, we had the notion of no-hitter that Joe Torres had shared with us. And so we're going forward with this now, a bit delayed because of COVID, but going forward. So I'm happy to answer any specific questions about the program or where we are now with it. Thank you, Deanne.
Thank you, Carol. Bobby Cagle, Director of the Department of Children and Family Services.
Good afternoon, Deanne, and good afternoon to everyone joining us here today. I want to first say I'm honored to be co-chairing this meeting along with Sheriff Villanueva, and I'm very excited about some of the things on the agenda today. The top priority of the Department of Children and Family Services certainly is the safety of the children in Los Angeles County. We are pleased to see the report from ICAN recently that showed a 73% decline in child fatalities due to maltreatment over the past 30 years. However, we also will never be satisfied until that number is 0. We will continue to work with all of our partners toward that goal, which we can accomplish. Child protection is also a community responsibility. We must be involved as government organizations, but we also must engage our communities to be most effective at doing this. And I must say that many of the community-based organizations that we work with provide the kind of services that Deanne referred to earlier that help lessen stress on families, address trauma that may have happened to children and their parents, and help them to map a better life forward. We also are here today to look at several recommendations, I think 15 total, that span the distance between legislation, policy, and practice that are all designed to assist us in reaching the goal of no child dying due to child maltreatment in our county. The campaigns, such as No Hit Zones, raise public awareness of the issues and the possible alternatives to this type of discipline with children. I must say that we're pleased to partner with ICAN on that, as we think that it can have some very positive effects for our county, not the least of which is to spur conversation about the things that children and families need. Again, I'm honored to work with all the professionals here today. I think we are blessed with a group that is very highly competent, very committed, and also am very honored to work with our communities to make sure that we are reaching out, that we are understanding what the communities need, and then also are addressing those needs in an effective way going forward. I again am glad to be here, and thank you very much, Deanne, for having me.
Thank you for being here. Very important job, difficult job, and we appreciate your time. Next, it's my great pleasure to present the Director of the Department of Mental Health for the County of Los Angeles, Dr. John Sheeran.
Thanks very much, Deanne, and I'm honored to be here as well to talk about such an important issue. And I salute both you as well as Sheriff Villanueva as our co-chairs. You know, this is a very difficult time because of the pandemic. And one of the things that the pandemic has really, I think, created is a new situation in our homes due to, you know, the isolation in general. And we really don't entirely understand what the implications are. We're not in everybody's homes. The likelihood that you know, that violence has gone up is significant. And I fear as we begin to understand more and more that we're going to find some alarming trends. You know, on that note, I would make a general statement, which is that trauma of all forms, whether it's because of the pandemic or whether it's because of abuse, has significant mental health implications. And we are just beginning to see the tidal wave of demand that I believe has been provoked, you know, and this isn't an LA County deal, this is global. With respect to this report, I'm very, very happy to see it. And there are three particular recommendations that I think are highly relevant for me for the Department of Mental Health. The Department of Mental Health is no hit zone. And that's something that I am fully endorsing and strongly behind. Secondly, the need for grief counseling. When there is trauma in a household, and certainly when there's a child fatality, it has massive ripple effects within a family and frankly, even beyond in neighborhoods. And we are, you know, we are going to take very seriously this recommendation and put together a more robust type of grief counseling that we may do. We may use, you know, other professionals to help us with. We already do this, but the idea here is to make it robust. And then, you know, lastly, one of the issues that that is challenging relates to pre and postpartum mental health issues. And, you know, we have a large county, we've got a ton of hospitals. We absolutely have to make sure that women, you know, who are pregnant and who deliver are being monitored carefully, and that when they leave the hospital with an infant and with potentially small children at home, that they're getting access to care if there are any signs of an emerging mental health crisis. And I think that's done, but it's not done in the way that it needs to be in terms of being robust and uniform. Is that the Department of Mental Health's responsibility? Directly unclear, but it is our responsibility, and I take it very seriously that we figure out ways to coordinate that type of assessment and the services being delivered with multiple partners across the county. Thank you for being here, and I look forward to talking in more detail in our meeting.
Thank you so much, Dr. Sheeran. The news media has been provided the 15 recommendations. We'll now open it up for questions through chat. Paul Click will monitor the chat and we'll read the questions as they come in. We can unmute you if you so ask. Let me again remind everyone that we have 15 broad spectrum recommendations that go deep into our child protection system today, and we'll be voting on all of those, and it will they will be presented to every agency in Los Angeles County that touches the lives of children. So do we have questions for any of our speakers? Have we technologically provided for our media to be able to ask questions, Paul? Again, we have a chat feature. And you can ask to be unmuted if you have a question. After my experience with the internet this morning, I have no confidence in technology. So I'll let the speakers make some final comments if they wish, and then we'll move on to the meeting at 1:30. The media has received the link to the meeting. If you did not, you may ask for that. We will be reviewing and voting on 15 action items. So Sheriff, would you like to make a closing comment or an additional comment, or Bobby or John? Or Carol? Carol, yeah.
Actually, I want to thank everyone for joining on this conference and this meeting. And I think we're raising important issues, and it's worthy of kind of getting a feedback from everyone and some good input, so we have a good pathway moving forward to just make the world a safer place for our kids that we hold near and dear to our hearts, for sure.
We do have quite a number of media here. So again, we'll invite you to link to the meeting and let us know if you don't have that link. It was sent out this morning. I want to particularly thank Dr. Carol Berkowitz, Chief Pediatrician, Harbor UCLA Medical Center. She has interrupted her vacation in Hawaii. So it is 3 hours earlier for her right now. And the negotiation of the time difference is very impressive. Carol, will you be joining the meeting?
I will, and I wanted to add a comment to Dr. Sheeran's, just to highlight the role of pediatricians in detecting postpartum depression and anxiety. You're more likely to see your child's pediatrician than you are your own obstetrician. So again, it's another opportunity, and we do our best to teach our pediatric residents to be sure at each well-child visit to just ask, how is the mom doing?
Extremely important issue. Okay, Sheriff, do you want to sign us off and then ask everybody to join the link for the ICAN policy meeting?
Yes, please. Let's sign off here, and everyone, you have the link. We'll restart again at 1:30 on the new BAT channel. So let's we'll shift over there.
Okay, thank you, everyone.